calculation.
Okay. What we do is this. Can you hear me? Can you hear me?
Yes, sir.
All right. So I think this is Zoom, and okay, I will try as much as possible. We'll just be looking at the material. I'll see how far we can go in terms of maybe where we see calculation. But any calculation we cannot solve here, maybe I'll do a video on that. Of course, I share the link. I share the link to you people. I share the link of the calculations I did on YouTube. Did you watch those things? I shared it.
Yes,
you guys should watch all those all those things because I'll set my questions from there. So you guys should try and watch all those things so that in case questions in that format comes, you don't have issues. Am I communicating? All right. So now let's continue from where we stop. This, as I said, this online class will be more of theoretical aspect of it because we have a lot to cover. This is how we're doing this every day until you come back from your. Even if I come for a normal lecture in the morning, in the night we'll still do this thing every day until you cover what you need to cover before your exam. Because I was told that your exam will be after the election. So thank God we have up to 3 weeks or 4 weeks, 1 month. So if we are considered and do this every day, 4 months, why won't you cover? We'll cover now. Yes. So because we are not together, if I do more calculation, I'll post. You guys should go there and watch it. Am I communicating? All right. So now, in that calculation, we got 24 mil, right? Are you with me? Christopher? Hello? 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 Who is there?
Hello?
Please, this is an online class. I always want to be sure that you people are with me. Once I say,
Hello, sir.
can you hear me? Can you hear me? Can you hear me? Hello, can you hear me? There was network issue. All right, so let's continue. So we continue from where we stopped. That calculation,
Okay.
the one we got 24 mil is clear, right? It's clear, right?
I said what?
That calculation we got 24 mil is clear, right? That last one we did.
Yes, sir.
All right,
Yes.
now let's continue. If you go down the material, are you with that material? Are you looking?
Yes,
are you looking at it?
Yes, sir.
All right. There's a place here. If you go down, you see where they wrote dose is based on the weight of drug. Am I communicating? Dose is based on the weight of the drug. Sometimes those, for example, for solid formulations. Examples of solid formulation is what?
Tablet.
Good. Tablet is an example of what? Solid formulation. Good. Now, sometimes the dose of a drug for solid formulation, the dose of a drug in most official publication is specified by the weight or weight range. For example now, something like paracetamol the dose is in mg, is in weight. Am I communicating? It's in mg for solid formulation like paracetamol now. I said that for solid formulation, we are discussing the dosing of drug based on the weight of the drug. Now we are starting with solid formulation. For solid formulation, the dose is in weight. For example, it's in weight, which is the unit we normally use is mg. We have something like paracetamol now. You hear that the dose is 500 mg, 250 mg, 1 gram or 1000 mg. Is it clear? Now,
Yes, sir.
something like that. Someone can never come and say that the dose of a paracetamol tablet is a male. Is wrong, because it's a solid what? Formulation. Because it's what? A solid formulation. Now, something like a codeine phosphate. Codeine phosphate by mouth, orally, the dose is 30 mg. It's a range, 30 mg to what? 60 mg. Am I communicating? 30 mg to 60 mg. And they will not specify to you how to use it. The frequency of what? Administration. This is how to dose. This is what you see when you talk of the dose for solid what? Preparation. Now there's a question. There's another example here. Example 7.6. It says a prescription requires a patient to receive 20 mg domperidone in tablet form every 8 hours for 4 weeks. How many tablets should the pharmacist dispense? A prescription requires a patient to receive 20 mg domperidone in tablet form every 8 hours for 4 weeks. Now, the patient is to receive 20 mg domperidone now. The dose is 20 mg. Is it clear now? The dose is what? 20 mg. Every 8 hours for 4 weeks. So that means in a day, how many mg would the patient take in a day? Every 8 hours is 3 times a day, right? Yes, every 8 hours is 3 times a day. So how many mg would the patient take a day? 20 mg times 3, which is what? 60 what? But be careful about this type of thing. You will ask how many tablets will the pharmacist dispense. For you to know the number of tablets the pharmacist is to dispense, you must know the presentation. That is the strength of domperidone in the market or in the pharmacy. Remember, this question is trying to portray the difference between strengths and what? Dose. Remember, difference between what? Strength and what? Dose. Now, for you to be able to, yes, you have known that a day is 60 mg, but how many tablets? What is the strength of that domperidone in the market? This is what will help you to answer this question. You cannot answer this question if you don't know the strength of domperidone in the market. Actually, domperidone is available in 10 milligram tablets. Am I communicating? Have you now seen this thing that will now point out again the difference between strength and what? Dose. The dose you are asked to give is 20 mg. But the strength is what? 10 mg. So now, how many 10 mg? How many 10 mg tablets will the patient take a day? If the patient is to take
I think it's 6 tablets.
Good. 6 tablets every day. Please, who is Chamzi? Chamzi, please, mute your mic. Mute your mic, unless you want to talk. Please, there's noise in your background, please. All right, let's continue. So, if the patient is to use So the patient will use 6 tablets of the what? Please, Chamsi, there's noise in your background, please. Is either you off what is making, or you mute. All right, let's continue. Let's continue. So, it's either you give. Now, had it been, let's assume that the domperidone in the market is 20 mg. So, how many tablets would the person be giving?
It's 3.
Good. So, the person will be giving 6 tablets a day. But you were asked to take for 4 weeks. How many days are in a week? There are 7 days in a week. So, that means there are 28 days in 4 weeks. True of us? So if there are 28 days in 4 weeks, that means how many tablets will the patient be given for that 4 weeks?
168.
Good. 6 tablets times 28 days, which is what? 168. Good. So the patient will be given what? 168 what? Tablet. As stipulated on the. Hope it's clear. Hope it's clear.
Yes,
all right. So we'll continue. Once it is 11:30, this particular Zoom, this thing will end. This session will end. Immediately, I'll create another link. Just you push your standby. Once this one ends, I'll create another one again. You click on it again and continue. We'll continue our lecture. Is it clear? So once it's 11:30, this thing will go off. And once you go off, I'll create another one again and post. You click on it and continue. All right, let's continue. We have just 3 minutes to go for it to go off.
Okay.
Now, this particular one now, this instance is when you have only one active ingredient in the tablet. What of situation? On occasions, in some occasions, two strengths of the same medicinal product can be used to obtain the correct dose. Okay, sorry, this one is not about fixed dose combination. Listen carefully. On occasions, 2 strengths of the same medicinal product have to be used to obtain the correct dose. You know what it means? Sometimes 2 strengths, you can combine 2 strengths of the same medicinal product to obtain the correct dose. That means maybe they prescribed, you are told to give. I want to give an example now. Let me use that domperidone as an example now. Maybe they prescribed domperidone 20 mg, for example, and what you have in the share, you may have like maybe let's assume that the domperidone has 2 strengths. Maybe it has 5 milligram and 10 milligram. Are we there? And you want to dispense, but you don't have 10 milligram complete that will give you that the number of tablets needed. You may have to take some tablets from the 5 milligram to combine it to be able to get what you need. That is what this example is talking about. This particular section is talking about. Now there's another example here, example 7.7. I'll read it. We make use of it to solve the question, to show example where you have more than 2 strengths, more than 1 strength. Look at that example here, please. Everybody online should open this material we are using. Example 7.7 says, Christopher, read it for us. Christopher, read example 7.7 for us.
A patient requires 8 mg of drug X per day for 1 week, followed by 7 mg of drug X per day for the next week. Drug X is available in tablets of 1 mg and 4 mg. How many tablets of each strength should the pharmacist supply?
Good. Now take a good look at this thing. A patient actually requires 8 milligram of drug S per day for 1 week. So the patient just need 8 milligram for a day for 1 week. Then after 1 week again, the patient will be given 7 milligram of the same drug per day for the next week. So actually, the patient the patient need to take this drug for how many weeks? 2 weeks, right? The patient needs to take this drug for how many weeks? 2 weeks, right? Now, if the patient needs to take this drug for 2 weeks, the first week the patient takes only 8 milligram 1 daily. Then after 1 week, the patient takes 7 milligrams 1 daily. This is the dose, but the strength available is 1 milligram and what? 4 milligram. Now, then I ask, how many of each of these strengths should the pharmacist supply? If you watch, for the first week, you can simply give the patient 2 tablets of the 4 milligrams, true of us. Christopher, who is making that noise in your background? They are disturbing us, please.
Okay, sir. Sorry.
I said that if you check, the 2 strengths available are 4 milligram and what? 4 milligram and what? 1 milligram. 4 milligram and what? 1 milligram. Are we there? 4 milligram and what?
Yes, sir.
4 milligram and 1 milligram. Now, but for the first week, the patient need to take 8 milligram daily for 1 week, right? Now, for the patient to achieve this, you can simply give the patient the 4 milligram, 2 tablets of the 4 milligram daily. It's true of us. Is it clear?
Yes, sir.
Good. Because the first week, the patient needs 8 milligram for 1 week. But 4 milligram is available. So you can simply tell the patient to take, you can simply give the patient 2 tablets of the 4 milligram daily, okay, for 1 week.
Yes, sir.
So so for the first week, how many 4 milligram tablets will it take for the first week?
For the first week.
How many?
It's 52.
No.
For the first week.
For the first week, he said that the patient will take 8 milligram daily for the first week. And I say, okay, that you can simply give the patient 2 tablets of the 4 milligram daily for 1 week. Mm-hmm. So how many 4 milligram tablets would the patient take for 1 week? First week. 14, right?
Yes, sir. Yes.
Perfect. So that means you write down something. Write down that the patient will take 14 tablets of the what? 4 milligram. 14 4 milligram tablets. Now, what of the second week? The second week, we are told that the patient will take 7 milligram for 1 week. So how do we combine it? 7 milligram for what? 1 week. So 7. How many 4 can we find in 7? 7, we have 4 and 3, right? 4 plus 3 make 1, is equal to 7, right? Up here?
Yes, sir.
So that means the patient can take 4 milligram, 1 tablet of the 4 milligram in a day, right? To get that 7 milligram, how will you combine the 1 milligram and the 4 milligram to get 7 milligram a day? How will you combine the 4 milligram and the 1 milligram tablet to get 7 milligram dose? Charles, tell me fast. The person
take 1 4 milligram tablet, then 3 of the milligram tablet.
Perfect. So the patient will take, for the next 1 week, the patient will take 4 milligram, 1 milligram of the what? 4 milligram, 1 tablet of the 4 milligram, and the 3 tablet of the what? 1 milligram in a day, right?
1 milligram.
In a day. So multiply by 7 days. What will it give you? So 4 milligram will be how many tablets? For 1 week?
7.
7. Then
7 tablets.
Good. Then 1 milligram will be how many tablets?
21 tablets.
Good. 21, right? So now we have 21 tablets of
Yes,
21 tablets of the 1 milligram, right? Then use
Yes,
that.
sir.
Add this 7 milligram, this 7 tablet of the 4 milligram to the initial 14 tablet of the first week. It will give you what?
21.
So the patient will take 21 tablets of the 4 milligram and the 21 tablet of the what?
21 tablets.
Of the 1
milligram.
milligram. So if you want to give the patient, let's assume you are working in the hospital now and you want to give the patient the drug, see what you would do. Just count 21 tablets of the 4 milligram and put in envelope. Am I communicating? Then count 21 tablets of the 4 milligram and put in envelope. Then label it. You will not tell the patient for the first week, take from this envelope. Envelope will give only 4 milligram. You label it the 4 milligram. The patient should, for the first 1 week, the patient will take only from here 2 tablets for 1 week, right? Then for the following week, you got the patient 2 from the 4 milligram tablet. 1 from the 4 milligram tablet, or 3 from the 1 milligram tablet every day until August. Is right? Is it clear?
Yes, sir.
Is it clear?
Yes, sir.
All right. So this is the answer to that question. So you are going to dispense 21 tablets, supply 21 tablets of the what? 4 milligram and 21 tablets of the what? 1 milligram. So if you watch in the examples, the 7.6 and 7.7 we talked about, only tablets have been used to illustrate the basic calculation. However, in practice, similar calculation could involve suppositories, capsules, powder, or even any other solid dosage form. So we only use tablets. Remember, we are talking about solid formulation. We just use tablets to give examples. This example can also be used. Suppository can be used to give such example. Capsule can be used. Even powders can be what? Used. And in fact, any solid dosage form can be what? Used. Now let's go to liquid formulations. Let's go to liquid formulation. Now, liquid formulations, thank God in our last class, in our last lecture in the class, we were able to say, I was able to describe one or two things about liquid. Hello? 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 Okay. All right. So now let us look at, in our last class, I was able to, say one or two things about liquid formulation. So I don't think liquid formulation will be an issue for us now. So now let's look at liquid formulation, how to dose liquid formulation. Liquid formulation can be prescribed using the weight of the drug as a dose. You can, in fact, there's something I didn't talk about. Listen carefully. In liquid formulation, I thought I have silenced the person that is making noise, but it seems it's Chamsy. There's nothing in your background. It's Chamsy. Oh, it's Chamsy in our course here. And let's continue. Now, Chelsea, please settle what is causing that noise in your background. Then you can unmute your mic if you settle it. All right, let's continue now. Now, in liquid sir, let me ask you, see, there's something I want you to know. There are some people that we want to prescribe drug. They will tell you maybe paracetamol syrup. They will say syrup paracetamol 5 ml 3 times daily. That is a wrong prescription. Did I mention it in your class? Did I?
No, sir.
Good. It's wrong.
No.
It's wrong because why I said it's wrong is because you don't even know how the paracetamol you are going to use, the pharmacist is going to dispense, how it is presented. Let's assume that there's a child that needs, for example, now a child that needs. Anyway, paracetamol is simple. Let's use something like amoxicillin. For amoxicillin now, a doctor, a physician will now come and say suspension amoxicillin 5 ml every 8 hours for 1 week is a wrong prescription, because that 5 ml you wrote, that 5 ml is just a volume. It's not strength. 5 ml is just a volume. It doesn't talk about strength. Has to do with concentration. Now, when I discussed liquid formulation with you guys, I said that liquid formulation comes in how many milligram per ml? Am I communicating? I said something like amoxicillin maybe 125 milligram per what? 5 ml. 5 ml contains what? 125 milligram. There's also another presentation which may be 250 milligram per 5 ml. Are we together? Now, a doctor will now come and write 5 ml 3 times daily. It's wrong, because if you write it, what if the patient is a baby, maybe around 1 year or less than 1 year, and what the pharmacists have in the shelf is 250 milligram per 5 ml. You will not come and write 5 ml. If the person is not careful, or pharmacy technician, he will go and dispense the one of 250 milligram per 5 ml, which becomes overdose. It's not true.
Yes.
So it's always good to prescribe solid liquid preparation as milligram. If you want the pharmacist, the patient to use 125 milligram of amoxicillin, simply write suspension amoxicillin 125 milligram. Period. So that if the pharmacist want to dispense, the pharmacist will now look at the presentation, look at the one they serve, look at the one that will deliver 125 milligram in 5 ml. Even if the only one that the pharmacist has in the shelf is 250 milligram, 250 milligram, how many ml would the pharmacist tell them to give to the patient? I asked a question. I said, if a doctor prescribes suspension amoxicillin 125 milligram every 8 hours for 1 week. Now, but what the pharmacists have in shelf is amoxicillin 250 milligram per 5 ml. How many ml would the pharmacist tell the patient to use?
Is it for the whole of that 1 week?
Per dose, how many ml?
10 ml.
Check well. If a doctor prescribes amoxicillin suspension 250 milligram, 125 milligram, 125 milligram 3 times daily for 1 week, but what the pharmacists have in the shelf is amoxicillin 250 milligram per 5 ml. If the pharmacist want to sell that amoxicillin to the patient, how many ml would it tell the patient to take? It's simple now. I thought I discussed this in your class. The prescription says give 125 milligram of amoxicillin 3 times daily. But what the pharmacists have in the shelf is the one that contains 250 milligram, 5 ml contains 250 milligram. So how many ml will the pharmacist tell the patient to take to deliver that 125 milligram? How many ml per dose?
This half meal.
I don't get the question.
A prescription says give suspension amoxicillin 125 milligram 3 times a day for 1 week. If the pharmacist now went to the shelf, what he have in the shelf is amoxicillin 250 milligram per 5 ml. You as a pharmacy technician, how many ml would you tell the patient to take?
$2.5
Good.
per dose.
Because if 5 ml contains 250 milligram, how many ml will contain 125 milligram? Or not 2.5 ml? Aria.
Yes, sir.
So the patient will take we have to take 2.5 ml. Have you now seen why it's wrong for a doctor to prescribe 5 ml of a liquid suspension? Have you not seen the reason why it's wrong?
So how did you say?
Have you not seen the reason why it's wrong for a doctor to prescribe suspension amoxicillin 5 ml like that? Because there are different strengths. Okay,
Yes,
now let me now ask you a question. As a pharmacy technician, you see a prescription. You see a prescription that says. Hope you are listening to me.
Yes, sir.
As a pharmacy technician now, you see a prescription that says amoxicillin 5 ml. Suspension amoxicillin 5 ml. Let me ask a question. You just see one piece of paper that just come into your pharmacy, and you look at it. You see suspension amoxicillin 5 ml 3 times daily for 1 week. You were a shelf, okay? What you see in the shelf, Bolo, I'm putting 2 strengths of amoxicillin. Inwelo amoxicillin 125 milligram. Huh? Hello?
Hello.
Can you hear me?
Yes, sir.
Can you hear me? Huh?
Continue, sir.
All right. Let's assume you are working as a pharmacy technician, and the prescription comes. You just see a piece of paper that entered. Somebody comes with a piece of paper. Inside it, a doctor prescribed suspension amoxicillin 5 ml 3 times daily for 1 week. But what you have in your shelf is amoxicillin 125 milligram per 5 ml. You also have amoxicillin 250 milligram per 5 ml. Which one are you going to give?
Sir, the prescription is not correct.
It's wrong.
Yes, there's no.
Have you not seen why I said that it should come in not a male? It's wrong because it can bring confusion.
Yes, sir.
Unless the doctor is aware of the one you have in shelf already. Am I communicating? Unless the doctor is aware of the one you have in shelf. Imagine no if you nemelo ngudi water. No magoro nkunu nwe. But what of room about 3-4? Can you get me? So it's wrong. All right. So let's continue.
Okay, sir.
Let's continue. Now, are we together?
Yes, sir.
Can you see the slides? Can you see the slides
Yes, sir.
clearly? Can you see the slides clearly? Huh?
Yes.
All right. So I'm trying to get to where we were. All right. Hello. Please. Who is making that noise, please?
Can hear you, sir.
All right. There are people that cannot stay without making noise. Hey. Wow. This my slide is messing up. All right, let me just. Can you see anything? Are you with me? All right, now let's continue. So liquid formulations may be prescribed using the weight of the drug as the dose. For example, now a prescription may state 250 milligrams of paracetamol to be taken twice a day, supplied as a what? Suspension. So let's assume now, I want to ask another question. Let's assume now the paracetamol you have in the shelf is 125 milligrams per 5 ml. But the prescription says that you should give paracetamol 250 milligrams twice a day. How many ml will you tell the patient to take?
10 mil.
10 ml twice a day, right? Good. Let's continue.
Yes, sir.
Now, so the paracetamol oral suspension contains 250 milligram paracetamol in each 5 ml. That is, what if the one you have in your shelf is one that has 250 milligram per 5 ml? How many ml will it take the patient?
I didn't get it.
What if the one you have in your shelf is 250 milligram per 5 ml? How many ml will it tell the patient to take?
The 5 mil.
Good, 5 ml. Good. So if the dose is expressed as the weight of the drug, then in the case of liquid formulation, the dose to be taken by the patient may be 5 ml or multiple of 5 ml. Perfect. Now, there's an example here. Listen to this example. Example 7.8. You can also open the material. Example 7.8 says a prescription A prescription requires 360 mg of paracetamol. A prescription requires 360 mg of paracetamol to be taken 4 times a day for 3 days. A prescription, hope you are listening.
Yes, sir.
A prescription requires 360 mg of paracetamol to be taken 4 times a day for 3 days. Supplied as a pediatric paracetamol, 120 mg per 5 ml suspension. Calculate the volume of the paracetamol suspension to be supplied. What's the answer? They say that the prescription says 360 mg of paracetamol to be taken 4 times a day for 3 days. But what we have in the shelf is 120 mg per 5 ml paracetamol. As I said, get the volume of this suspension to be supplied. What's the answer? To be able to solve this question, you should be able to know how many ml to be supplied a day. So how many ml do you think that should be supplied a day? You start from a ml that
15 mil.
A day. A day, 15 ml or a dose. Which one are you saying?
Okay.
A day is 15.
A day is 60 mil.
A day is a dose is how many ml?
A day is 15 mil.
Let's start from a dose. A dose is how many ml?
15 mil.
15. So that means a day is how many ml?
15.
A day.
60 mil.
60. Then for 3 days.
60 mil.
3 days. The answer is 180 ml, right?
Yes, sir.
Good. Now, sometimes if the liquid formulation is prescribed for a very frail person, you know who is a frail person, right? A frail person is someone that is good. Good, yeah, or elderly. Am I communicating? Or a very young, child, Sometimes the required dose may be less than 5 ml. Am I communicating? Sometimes, depending on the strength of the dose anyway and the strength of the drug, sometimes it can be less than what? 5 ml. Now let's look at example 7.9. Example 7.9 talks about such situation. Example 7.9 talks about such a situation. Now let's look at Chumsy, read, please. Chumsy, please. Who is this Chumsy, please? You are renaming is what, please? Who is this Chumsy, please? You are in him, please. I like identify my student with the arena, not yeah. Hello? Hello?
No.
Chumsy, I'm asking.
She muted her mic.
What's her name?
Rose.
Okay, Rose. Okay, good. What of these hot, getting hot, Onyokeke? Okay, Onyokeke. Who's Onyokeke?
I don't know who is the person.
All right, let's continue. Okay, I think I'll
Okay.
Okay, I'll go in. Okay.
Yes, sir.
All right, let's continue. Now, okay. So, I go in. Read example 7.9 for us fast.
Example
7.9.
7.9. A prescription requires a dose of 200 milligrams of paracetamol. What volume of... Yes. Can I read that one?
Yes. Continue.
Okay.
Below you see a prescription requires...
Suspension.
Below you see. Start afresh. It seems our network is having issues. Oh yeah. Really, again, start from the beginning.
A prescription requires a dose of 200 milligrams of paracetamol. What volume of paracetamol suspension, in bracket 250 mg, over 5 ml, per 5 ml, will provide a dose of
200 mg. All right. It says a prescription requires a dose of 200 mg of paracetamol. Good. What volume of paracetamol suspension, 250 milligram per 5 ml, would provide a dose of 200 mg? Now, can I ask a question? I want to ask a question. I want you guys to tell me which of these numbers, which of these things, which of them is strength and which of them is dose?
The 250 milligrams is the strength. By the 5, the dose is
the dose is what? The dose is what?
The dose is 5 ml.
Dose. Here you go. That is incorrect. The dose is what? Who can tell me the dose? The dose is the
200. 200.
Good. We define those as the amount of drug that will elicit what? Therapeutic what? Effect. Is not true. Require therapeutic effect. Is not true. So they want to treat fever or headache. So the amount of the drug that will take care of it is 200 mg. So that is the dose. But the strength is how the drug is presented. The drug on the shelf is presented as a liquid dosage form. So it's presented as what? 250 milligram per 5 ml. That telling us that 5 ml contains what? 250 milligram. Is it clear? So this question now is trying to want us to know the amount, how many ml that will deliver 200 mg. If 5 ml contains 250 milligram, how many ml or contain 200 mg? That's what the question is asking. Is it clear? Is it clear? I say that a prescription requires a dose of 200 mg. That is the dose you are supposed to give to the patient. As again, when a chef 250 milligram per what? 5 ml. Ọ bụrụ na ị na-alụ ọrụ ebe a na pharmacy ebe ị na-alụ ọrụ, nke a de 200 mg bụ ife doctor delegate ga-enye patient. Mana 250 mg per 5 ml bụ ihe de na-alụ ọgwụ ị nwere na ya chef. Na packet of the drug you have in your chef, asking na 5 ml contains what? 250 mg. Now, how many ml ka ị ga-asị the patient nwụzia ebe ọ bụ na 5 ml contain 250 mg? Do it now. I'll give you 5 seconds. Do it and tell me the answer fast.
4 ml.
4 ml. 4 ml. Do we agree? Do we all agree? Do we all agree?
Yes, sir.
Good. Because 5 ml is to 250 milligram of where? Therefore, how many ml will be 200 milligram of where? So you cross multiply and get your answer. It's simple. So it's 4 ml. So you can say the patient because ogwa for 4 ml. how will the patient, can someone tell me, how can this patient get formula? Can you form formula of this drug using what? What can be used to get this formula?
I think it's
Huh?
Using
what?
The small spoon.
No. We discussed this in your class. Oral syringe.
Yes.
Oral syringe. Small spoon cannot give you formula because it's not calibrated. You cannot get formula there. You can easily use oral 5 ml oral what? Syringe, because here there you can get you can get 4 ml, you can get 3 ml. True or false?
True.
So you use oral what? Syringe. Is it clear?
Yes.
Good. So now what if this liquid formulation, we'll be talking about how to dosing of liquid formulation. We're talking about oral. There are liquid formulation in the form of injection. Hope you know. Hope you know. Are you aware? So how will you now dose? Let's talk about the posology of what? Liquid what? Of injections in liquid form. So injections are also another form of liquid what? Formulation. Do you agree?
Yes, sir.
So in some situations, the dose required may be expressed as a weight, and thus the dose will have to be converted to a suitable what? Volume. Now let's look at example 7.10. Example 7.10 will help us. Christopher, read example 7.10 for us. Fast.
A patient requires an intramuscular injection of 0.5 mg of adrenaline.
Mm-hmm.
Adrenaline is available as an injection containing 100 micrograms per milliliter.
Mm-hmm.
How many milliliters of injection will supply the required dose?
Good.
Note, do not confuse micrograms with milligrams.
Of course, you know that now. I did the same thing. Milligram is... what is the power of milligram in terms of gram? What is the power?
10 raised to power minus 3.
What of microgram?
10 raised to power minus 6.
Perfect. Good. So now let us solve this question. Please, anytime you are giving, I want you, anytime you are giving question in FARMCAC, bring it, make it practical. Imagine it. Create a practical scenario in your mind. Learn how to create a real life scenario in your mind. That is the only way you can appreciate this course. Create it in your mind. A real life scenario. It's very important. Ask yourself, what if I'm a pharmacy technician working in social place? This is what I am expected to see, and this thing comes to me. So I want to create a real life scenario using this question now. But let me read again so that before creating it. A patient requires an intramuscular injection of 0.5 milligram adrenaline. Adrenaline is available as an injection containing 100 micrograms per ml. How many milliliters of injection will supply this required dose? Now, let me create a real life scenario. You are working in the pharmacy, maybe or even in the hospital, in an emergency department, in an accident and emergency or so, as case may be. You are there, a precision rank came in. You see the precision say that you should give IM, that you should supply IM adrenaline 0.5 milligram. IM adrenaline 0.5 milligram. Start. That is the prescription. IM adrenaline 0.5 milligrams. Start. Of course, you know what start means, right?
Yes.
Good. Now, but what you have in the shelf in that emergency pharmacy, as that an emergency pharmacy, what you have in the shelf, the adrenaline you have there, the adrenaline injection you have there, whether in the shelf or whatever, but the point is that the adrenaline you have there is, if you look at the bottle, you see that 1 ml contains, if you look at the back of the bottle, you always see 1 ml contains 100 micrograms of adrenaline. So how many ml will you give? Is the real life scenario clear? Is it clear? Eh? Hello?
Hello, sir.
I said,
Hello, sir. I didn't get you.
I said, is the real life scenario I created, is it clear?
Yes, sir.
You are in an accident and emergency pharmacy, but a prescription comes in saying, I am adrenaline 0.5 milligrams. Start. But what you have, the adrenaline you have there, in the bottle, the adrenaline you have there, if any 1 ml contains 100 micrograms. So how many ml will you give? Do you understand the real scenario I created?
Yes.
Good. For you to solve this question, adrenaline is already in what? The prescription there is in 0.5 milligram, right? But what you have in the shelf, but what you have in the shelf is what you have that is 1 ml contains 100 microgram. Do you think it's better to convert microgram to milligram or to convert milligram to microgram?
To convert milligram to microgram.
Anyone is okay. But for convenience, just convert milligram to what? Microgram. Because so if you convert 0.5 milligram to microgram, what will it give you? Have you now seen how this thing goes? If you didn't understand measurement, if you didn't understand matrix system of measurement, you will not be able to do this conversion. Do you not see why we did it first?
Yes, sir.
Now convert 0.5. Now convert 0.5 milligram to microgram. Fast. What's the answer?
500 microgram.
First, tell me how many microgram make 1 milligram? How many microgram make 1 milligram?
1000 microgram.
Make 1 milligram, right? Good. So that means if 1 milligram is equal to 1000 microgram, right? Therefore 0.5 milligram. If 1 milligram is 1000 microgram, right? Therefore 0.5 milligram, which is equivalent to half milligram of should give us half of 1000 microgram, which is what? 500 microgram. Is it clear? So now use it to solve this question. If 1 ml of what you have in the emergency pharmacy, if 1 ml of the adrenaline injection contains 100 microgram of adrenaline, therefore 500 microgram should be contained in how many ml? What's the answer?
5 ml.
5 ml. Do we all agree to this? Do we all agree?
Yes, sir.
Christopher is not the only person there. I think we're up to 5 there. So others should talk. Do we agree? And all our mics are on. Who is this iPhone? Who is this iPhone? Who is iPhone? Eh?
I don't understand. You are lost.
Who is lost?
Size Rose.
Rose is lost. Who else is lost?
Who is lost?
Who else is
I
lost?
don't get it.
Who else is lost? Say your name. Who else is lost?
Yeah.
Huh?
Why is the last one? Can you ask me?
Miracle.
Yes, sir.
Okay. Miracle, I don't even know where to start. You just came in. I don't really even know where to start from now. You just came in. Huh?
I'm like,
Okay, now. Okay, let's just listen, please. Let's just listen, please. Please, let's focus, please, let's focus. You know, this thing is an online class. This is an online lecture. This is an Who is talking again? Who is talking again? Huh? Hey. Miracle 2 they play.
That's where she is everywhere.
Someone has said that I don't understand. Turn on it. Start to talk about nothing. This is online class. If you're not careful in online class, you will not even learn anything, because you can be in your room playing without even because nobody is seeing you. You're playing up and down. So please, I want you to focus, please. Now let me see how far I can go. I said, let me look at this quick example 7.10 again. I said a prescription batalo na pharmacy ebe na alụ. Let me use Igbo language. The prescription batalo na pharmacy ebe na alụ. Inaya na akwụkwọ ife de na retin mbụ IM adrenaline 0.5 milligrams. Start. This is the dose you are told to give. That's dose. And for the doctor to write that dose, the doctor has seen that this dose is what will help to take care of what they want to treat. True or false? Now, that's the dose. But the adrenaline you have in the shelf, or whatever shelf, or wherever in the pharmacy, the adrenaline you have there, if you want to know, look at the packaging or the bottle. You will see where they will write 1 ml contains what? 100 micrograms. That's the strength of adrenaline in that liquid preparation. How many ml will you now give from that bottle to be able to deliver 0.5 milligram of what? Adrenaline. How will you know? If you check, adrenaline in the prescription is already 0.5 milligram. So you convert 0.5 milligram to microgram.
Understand now.
So if you convert 0.5 milligram to microgram, you have 500 what? Microgram. So the dose is 500 microgram. How many ml of this adrenaline can you inject to be able to deliver 500 microgram? If 1 ml contains 100 microgram, how many ml will contain 500 microgram? How many?
5 ml.
5 ml. So 5 ml will contain what? 500 microgram. So actually the patient should receive 5 ml of the what? The patient should receive 5 ml of the what? Injection. Is it clear? Is it clear?
Yes, sir.
Is it clear?
Yes, sir.
Good.
Yes, sir.
Good. Good. I think anybody that doesn't understand this should go to your. Hope you have your discussion group. Go to your discussion group and discuss it. It's simple to understand, so we don't waste time. It's late already. We have entered another day.
Sir.
So let's go. So I want to finish this. I want to see how far I can go. So in our next class, we'll enter. Okay, I don't think we can finish this tonight itself. Let me just see. There's another thing I want to talk about: overdose. if you're not careful in your administration or your calculation before you give the drug, you can give what? Overdose. So this is very. I said that you should be checking overdose. iPhone, what are you doing? iPhone.
Miracle.
What is she doing?
I want people to remove this, so the people let me. Hey!
Miracle, must it be you?
Come on. I'm
Kedip Barakadikun. Hey, everybody. Now, are you with me? Are you with me? So you check for overdose. Check for overdose. Sometimes, most of in fact, this whole thing we're talking about, an important thing you should note in posology is that it will help you to guide against what? Over what? Dose. Against what? Over what? Dose. Remember that every drug has its own side effect and adverse effect. True or false? So the more you increase the dose of a drug, the more you increase its side effects. It's not true. So if even at normal dose, every drug has side effects. So if you now give it overdose, you are increasing more trouble for the what? Patient. So whenever you are reviewing a prescription for a patient, it is important to ensure that the patient is receiving the right what? Dose at the right what? Hello? I said, whenever you are reviewing a prescription for a patient, it is important to ensure that the patient is receiving the right drug at the right what? Dose. So if they give you prescription, don't just jump, boom, and go to the shelf, boom, and start. No. Check the prescription again. Be sure that the prescription is at the right drug is written, and the right dose is what? Is what is prescribed. If you find something ambiguous, speak to your what? Pharmacist. If you find something ambiguous, speak to what? Who? Your pharmacist. Now, to check whether a dose is correct, a pharmacist will need to check the dose against the recommended dose in the BNS. So how do you know whether a dose is correct? That's why you should have these official books. You were taught official books, right?
Yes.
Good. That's why you should have these official books on your desk. You have your BNF. For Nigeria, you have your MDEX. You have your MDEX at your desk or the app in your phone. Anyhow, have it. When you see prescription, you check that what was prescribed, confirm with what you have in your official books. Be sure that it is correct. Also check the maximum dose, whether the maximum dose has been exceeded. It's very important. That's what is called maximum daily dose. Ensure that it's not exceeded. If it is exceeded in a prescription, and if it's not even the right dose, call the attention of your pharmacist. The pharmacist is the one to speak to the doctor, or in that situation. Unless you are working in a place where there is no pharmacist, you have no choice than to go and see the doctor to discuss it with the doctor. So in most cases, it may be a mistake. So don't keep quiet and assume that the doctor knows it all. It's not true. Now let's continue. So the maximum dose that a patient may take is expressed in different ways in the word BNF, in those official books. So there may be a normal dose or dose range stated either a milligram. So there's most cases you will see, if you open those official books, you will see the normal dose. Sometimes it may be as a single just dose weight. Sometimes it may be a range, depending. So Something like mefenamic acid. Mefenamic acid dose for an adult is 500 milligrams 3 times a day. Sometimes some drugs may be, some medicine may be given as number of tablets, especially those that are come in fixed dose combination. Sometimes it may just come as number of tablets. So let me not waste time. Go through this checking for overdose. Am I communicating? Go through it. It's easy to watch, understand. I've told you the most important thing you should check out when you are when you are filling a prescription. You review the prescription to see whether the actual dose is what was prescribed, and also whether the maximum dose has been exceeded. Compare it to what you have in your official book. If you notice any discrepancy, don't take a decision on your own. Speak to your doctor or speak to your pharmacist directly. If there's no pharmacist, you can go to that doctor directly and talk to the doctor and discuss with him. At the end, you may be able to get a right thing, do the right thing. Am I communicating? Am I communicating? Am I communicating? Good. Please read this checking for overdose. Please read it. It's easy to understand. If there's anything you don't understand there, call my attention. I will explain to you. Am I communicating? Please, anything I say you should read. Anything I open my mouth and say you should read, take it seriously and read it. You get why. So if I tell you read something, read it. You get why. Now, sometimes, are you aware that when a patient are you aware that the kidney is vital in drug elimination? True or false? Are you aware? Sure you did your pharmacokinetics now, right? About drug absorption, metabolism, excretion, elimination, right?
Yes, sir.
So I said that kidney is vital, is pivotal in drug elimination. True or false?
True.
So if a drug is taken and after the whole thing, and that drug is not eliminated, is not clear from the system. I think the right word is clearance. It's not clear from the system. What do you think will be the effect on the system?
I don't get.
If a drug is taken, then after the whole thing, after doing its work and it's not cleared from the system, what will be the effect?
Yeah.
What?
Kidney problem.
Toxicity. Toxicity. Good. Now,
yes.
What organ is pivotal in this clearance?
Kidney.
So, if a patient has kidney problem, do you think that clearance will be achieved?
No, sir.
So, if a patient has kidney problem, clearance will be issued. So, the patient will be to accumulate in the system, and it will be toxic. True or false? Good. Now, because of this, for a patient that has renal problem, kidney issues, there's what is called dosage adjustment. You adjust the dose of the drug so that there will be no much effect when it is not totally clear from the system. So, in most cases, you divide the dose. If the normal dose is like 200 mg, you try to give around 100 mg. Am I communicating? To make we call it dosage adjustment in terms of renal problem. Am I communicating? Good. So this is also what you consider in dosing. So there's what is called doses in renal impairment. So many drugs are excreted by the kidney either as the drug or its metabolites. You know what metabolites are now? Metabolites are product of what? Metabolism. True of us? Good.
True.
So many drugs are
Hello.
Hello? Are you with me?
Yes, sir.
All right. So many drugs are excreted by the kidney, either as what? Drug or is what? Metabolites. So reduction in the function of the kidney may mean that the dose of the drug needs to be what? Reduced. Are we there? So, and when another reduction in the kidney function, the best thing is to reduce the dose of the what? Drug. That's the best thing to do.
Yeah.
So, chronic kidney disease in adults, the UK guidelines for identification, management, and referral define renal function as follows. Degree of renal impairment, yeah, but long story. Go through it. I don't want to waste our time there. It's self-explanatory. Yeah, just formula you will need to use to determine the what? Clearance of the what? Of what? The drug from the what? Kidney. Please go through it. I don't want to waste our time there. Am I communicating? Am I communicating?
Yes, sir.
I don't want to waste our time there. Now, I don't know if we have any question so far. Ask. We will soon, once our time expires, we'll stop. We are not going to create another link. I think we have tried 2 hours to be here. Or 1 hour. Are there any questions so far? Any question?
No, sir.
So I want you to go through this thing, this clearance of a thing. Try to go through it. If you have any issue understanding it, in our next class, you ask question on it. I will explain that before we enter the next thing. Is it clear? So please,
Yes,
I want you to go through what we have done today. If you have any question, put it down. In our next class, I'll bring out the first 10 minutes to answer questions. I'll bring out the first 10 minutes to answer questions. After that, we continue from where we stop. So from tomorrow, once it's 10 o'clock, we'll start. Unless I have my unless I have other lectures. If not, once it's 10 p.m., we'll start. So that latest after 10 or after 11, we are through. So once it's 10 a.m., this Zoom, I will create 2 links. Once the first link expired, we'll join the second link immediately without wasting time. Am I communicating?
Yes, sir.
That's how we're doing it. Please,
Yes, sir.
please, if you are in your room, tell your roommates to keep quiet, or you mute yourself so that the noise they are doing in the background, making in the background, will not interfere. Mute your mic. If you want to ask questions, you unmute and ask questions. If you want to ask questions on Zoom, there's a place you can click, you raise your hand. Do you know? Are you aware? Check it. There's a place you click, once you want to ask questions, just click on that place. Your hand, I will see your hands up. Then I will allow you to ask questions. Please, if you are not talking, unmute yourself so that the noise in the background will not interfere with our class. Unless you want to say something, that's when you will. So from tomorrow, everybody should mute their mic. Unless I ask questions, maybe I ask questions to know whether you are following. You can unmute and talk and mute again. That is the best way to keep the lecture platform serene. Please tell others that think that we are joking, that we have started. We'll do this every day, on even during your election period. This is what we'll be doing. We must cover farm car, whether we like it or not. So we'll cover it for this first 1 week before you embark on your election break. I'll come to your class. We'll continue from wherever we stop. We're doing it Wherever we stop off offline, in the night we continue it online. This is what we'll be doing until we finish this course. Then at least we have up to 1 month. If we are consistent every day, we'll finish it. Am I communicating?
Yes, sir.
Please, let's take this serious. Then I sent you a link on lecture videos on FARMCAC. I told you to click on it. I don't know how many of you have clicked on it. If you click on it, you see different lectures I've recorded and uploaded online on FARMCAC. This is how I do lectures and upload. So anytime you want to watch any lecture in any topic, just click on that link. You see different topics. You watch any of the video of your choice.
WhatsApp.
Huh? Is that what?
Is it on WhatsApp?
I drop it in my WhatsApp group. I dropped the link there. The link is there. You will see the link there. It's written pharmaceutical calculation. Once you click it, you see different topics on FARMCAC. Click any of the topic of your choice. You will see any videos I have uploaded in that topic. I arrange it like that so that if you click, you can watch any video of your choice. I am advising you to watch those lectures. You get why? You get why?
Since you're teaching, you will to teach in class again.
Huh? Is that what?
Since you're teaching here, will you teach it again in class?
No. In class, I'll continue from where we stopped. In class, I'll continue from where we stopped. No time again to waste. No time again. This is the only option we have. After 1 week now, you people will go for 3 weeks break. 3 weeks is a very long period of time. So, in class, we'll continue from where we stopped. Wherever we stop in the online, we'll continue again until we finish this course. Is it clear?